Welcome to Verve Medicine Hub. I'm Dr. Amar Chauhan, and today I will demonstrate our latest Mulas patient, that is trauma buddy. And first, I will go briefly over the salient features, and then I will demonstrate the skill. So, coming to the features, this is a whole body mannequin, and this is easily assemblable and disassemblable. So, we just show how to assemble this because this in India we don't have mannequin operator in most of the skill labs, so it has to be user friendly. There should not be too much complexity when we are assembling or disassembling the mannequins. Okay, so this is a whole body mannequin. Now coming to the features, so what we have given, this is the ventilator simulator we have designed, and when you switch it on, then you can see we have given the scenario of tension pneumothorax on the right side. Come here, show that. So now this is a patient of road crash we have given, or you can assume that this is fall from height, and now this patient is in agony, has presented to you. So now coming to the airway, so here you can see that he has got a lot of airway injuries. So you can apply a cervical collar, you can do BVM, you can put NPA. Okay, that's airway. So if somebody wants, we can give intubation also. We can give jaw thrust, which will, like when we you do jaw thrust, then his voice will stops. His airway will be clear. Now the second is the breathing part. So breathing, we have given the scenario. We restrict करो, अभी रोक दो. So you want to switch it off. This is remote control based. So now what we have given in B scenario for tension pneumothorax. So we have given the distended vein. Now you can see there is a abrasions. So there are telltale sign that probably he has suffered some injury. Switch it on. On करो. Okay. एक ही side करना भी. You can see the movement is only on the left side. So right side is restricted. There is a telltale sign of the injury and the distended vein. So करो. So like what is here, like when you press here, patient groans, that means he has got something here, and that is like fracture ribs, we will assume. So now we encounter this scenario, tension pneumothorax. Of course, I will demonstrate the skill later on. Okay, so breathing, this is the important thing. Like tension pneumothorax will kill the patient immediately. Pneumothorax will take some time. Now in C, we have given three pulses, carotid, femoral, and DPA. And then we have given IO access in case of no peripheral vein scenario. And then when we give you the trauma body, we give the X-ray. So for that, there is a fracture in that X-ray, and we have given this greater trochanter, so that you apply the pelvic binder on the greater trochanter, not on the ilium. That's very important. That's why we have given them, made them little bit prominent. Okay. Now coming to D. Now this patient is in altered sensorium. So we have come here. So we have given a head injury, hidden head injury. That is why he is in altered sensorium, and his if you look at the pupil, then this is normal size and this is dilated. So one of the pupil is dilated depending upon the injury, and then in E exposure we have given back injury. दिखाओ पीछे वाला. So you can do a long roll. Come. So there is a hidden back injury also. Okay. So and I forgot to mention the catastrophic hemorrhage. That is very important. So we have made this according to ATLS protocol. So when you pump this pump, then there will be catastrophic bleed. Okay, so we will show it later on. And then we have given the fracture, and this is how you apply cat tourniquet to stop the catastrophic bleed. Now there is a fracture. You can teach student how to apply a Kramer wire, but more than that, we have given DPA. So you can feel the DPA over here. Okay, so we have given three pulses: carotid, femoral, nicely palpable, and the DPA. That's what we need to teach our student. When you apply Kramer wire, please feel for the pulses. Okay. And then to give urogenital bleeding, we have given urethral bleed. Urethral bleed, yeah, bleeding wala dikha. So you can show yes, just for urethral bleed. Actually, this is an ordered mannequin. That's why we don't want to spoil it. So this is what, like, sometime like you have to, you know, look for the hidden area. Okay, fine enough. Now we will show the catastrophic bleed. Again, I'm saying this is an ordered mannequin. We don't want to spoil it. पूरा लगाओ. जाओ पीछे उधर. So you can see catastrophic bleed. It will that yes. So it will spurt up. So you can apply cat tourniquet. And I'm very sorry to say, not even big hospital have this cat tourniquet to stop the catastrophic bleed. So this is our feature which we want, because trauma means bleeding and bleeding means death. So that's why we want, like, there's a stop the bleed program going on in USA, and similarly we want layman to stop the bleed by applying something, and in hospital we must apply the cat tourniquet. Okay. Now coming to the skill. So first skill, I will demonstrate the tension pneumothorax, how to decompress a tension pneumothorax. So again, you can start the ventilator. Now you can see, come over, we have to show the, so you have to operate this mannequin, that's why. So now it is the only needle to मेरे को बड़ी वाली, left side, right? So immediately we have to decompress. Okay. Now distended vein, fourth or fifth intercostal space. So there is a air and this sounds. Now you will see that both the side of the chest, they are rising. Now there is equal expansion. This is what happens in real life scenario also. So initially the chest movement were there on the left side, right side were restricted. So we have done the needle decompression, and now the chest expansion is there on both the sides. So that's one important skill we need to teach our paramedics and doctors. Okay. Now the second skill will be, like, in case of no vein scenario, you have to go for IO access. Okay, so I will not go into the details of technique, but I'll just demonstrate. निकालो. This is another simple life-saving skill we need to teach even our doctors, right? I've been pleading everyone to start this as a matter of routine. Okay, so हाँ निकाल दो. Third skill will be how to, because we have given greater trochanter, how to apply a cat tourniquet. No, oh sorry, how to apply a pelvic binder. So you can apply the pelvic binder over the greater trochanter. Okay, and then you can learn how to apply the Kramer wire. And again, I will say, please teach them how to feel the pulse. We have given the DPA. So before we do that, we must feel the pulse. Okay, this is an IC palpable. Okay, so these are the features we have given. The skill: tension pneumothorax decompression, applying the pelvic binder, and then urethral bleed, don't put the forage catheter, and then IO access, and then applying the Kramer wire. I think if these things are taught and are done in real life scenario, a great deal of comfort can be provided to the patient, and hopefully that this Mulas patients, this is made in India, very low cost, will be quite valuable in teaching and learning. Thank you very much.